I'm Scott Gale. I'm a physical therapist with Legacy. I work at the Good Samaritan Outpatient Rehab Clinic, which you might have been to over in Building 3. I am a native Oregonian, born and raised here in the Portland area. I went to PT school in Missouri, and I spend most of my time kind of hanging out with my wife and 3 kids. Professionally, I treat a lot of orthopedic patients, but I also do some male pelvic floor, which is why we're here today. So we are going to kind of discuss. I'm going to get into this here. Uh, Here's our plan for my little topics here. We're going to discuss kind of the anatomy, the function, what is the pelvic floor, what does it do, how it's affected by cancer, treatment, surgery, all the things that come along with that. How physical therapy may be able to help, and some things that you can kind of start working on today, some resources that should be helpful for you. So getting into the anatomy of the pelvic floor, it all revolves around the pelvis. So the pelvis is kind of like a big bowl, right, without a base. There's a big hole in the bottom, and the pelvic floor is just what we've named that space on the bottom that's filled with muscles. And they do different things, but it's basically the whole area that would be sitting on a bike seat if you were to hop on a bike. The technical term for that area is the perineum. I don't know if you've heard that before. There are a lot of slang terms for it as well, but we'll call it the perineum. It's basically the whole area from the pubic bone up front, just above the penis, down past the anus and the rectum to the tailbone. So it's full of muscles and it supports a lot of different things, including all the organs and everything that's sitting inside of you. What it does is it provides support. It holds things inside, lifts up. There's a lot of weight in your abdomen with your guts, and the pelvic floor kind of holds it up. It is responsible for continence for both bowel and bladder. It keeps you from having any accidents on either end. And it also has a lot to do with sexual function as well. And we'll get into how that all works. So the pelvic floor, this is kind of I'm just diving right into it here. This is a shot of the pelvic floor from the bottom up. So if you look at this picture here, there's a few things we're looking at. We've cut away the skin and we're kind of getting into the muscles around the pelvic floor. Right there in the center is the anus. The external anal sphincter is labeled there. It's the muscle around that. The red stuff is muscle. The white is kind of a fascia. It's a covering that goes over muscle or bone. So we're looking at the opening here and all the muscles that fill it. So the pelvic floor has a few, let's see, can you see my cursor on the screen as well? Perfect. So we'll talk about the muscles here kind of in 3 different sections. Okay, so the back section around the anus, you have the external anal sphincter, which is a circular muscle, and that kind of opens and closes. It's what you have control over. If we talk a lot about bodily functions in pelvic floor therapy. If you pass gas or you keep yourself from passing gas, it's this muscle here that's kind of keeping that closed. Around that, you have this kind of horseshoe-shaped sling-type muscle called the levator ani. These muscles, they lift up and kind of close off the intestines from the inside. If you really are holding something back, if you have diarrhea and you have you're really squeezing hard, it's these muscles here that are doing the bulk of that work. Just forward to those, we have the transverse perineal muscles. Those are our steel girders. Those are the structural supports that hold things up and kind of carry the weight of your intestines and your insides. And then up in front of that, we have the muscles around the penis. So the muscles of the penis here, the base of the penis and off to the side, those help pump blood into the penis for an erection, help with ejaculation, that kind of stuff. But deep underneath those, we have a set of muscles that also house the urethral sphincter. So it's like the anal sphincter, but it's a sphincter that closes the urethra and keeps you from peeing. So this side view can kind of help us see that a little bit better. So let's orient real quick here. We've got the bladder, okay, which will fill with urine. That is also a muscle. We just don't have control over it. Then you have out of the bladder the urethra running through the prostate, which is right here, out through that muscle that we just talked about with the sphincter, and then into the penis and out. When you are stopping yourself from peeing when you're squeezing those muscles. It's this muscle right here that's closing off that urethra. Okay? Sometimes visualizing, understanding where these muscles are and what they do can really help us have a little bit more control over it. And then on the back side, you can see these muscles cut in half around the anus, the anal sphincter, kind of leading up into the intestines here. So that's the kind of anatomy. When we talk about pelvic floor, we're talking about all that good stuff, all those muscles and the organs that come in and out of them too. So moving into how pelvic floor is affected by cancer or surgery. This picture of Rocky here, he's kind of exhausted, and a lot of times when you go through treatments, whether it's radiation, whether it's a prostatectomy, or even a biopsy, initially, it's a trauma to the pelvic floor. It can leave you feeling these muscles feeling exhausted, feeling like they don't really know what to do, how to get up and get back to their normal function. So the muscle function can be disrupted. It can cause pain. It can hurt. There's the pain of the procedure, the pain of the surgery, but there's pain because the muscles are too tight, pain because they're not doing their job very well. It can lead to, tension in the abdomen, into the testicles, things like that. It can affect continence, which we'll get into a little bit more in a sec, but it changes how the muscles work and how they're able to do their function. A loss or change of sexual function, with the trauma to those muscles, it may be harder to get an erection, to keep an erection. Things are different than they used to be. And one of the big ones that we don't think about often is the emotional toll, the stress, the anxiety that comes along with it. As things are different, as things are changing, as you're working through issues, it feels like something's wrong, and it's can be embarrassing. It can be stressful, and we'll find out that the pelvic floor really responds to stress in a negative way. The more you think about it, the more you stress about it, the harder it is for it to work correctly. So physical therapy, what we do is we work through kind of muscle training. We can help, these pictures of PTs over here. This is kind of traditional therapy, helping people learn to walk, helping people rehab from a surgery or an injury. And we're doing the same thing, just with the muscles of the pelvic floor. So physical therapy works with muscles and with movement, and the pelvic floor isn't any different. The muscles can be retrained just like any other muscle in the body. We talked about incontinence. When we can help you feel and recognize when you're turning on the correct muscles or when you're not. The muscles that need to control your bladder versus your bowels. Sometimes those muscles can feel like you're doing the same thing, but really they're two different areas. And you may be thinking you're squeezing the right ones, but you're really not. We're all potty trained when we're little. It was many years ago for most of us, and after we're potty trained, we don't really think about those muscles and what they do anymore. We let them do their thing, and we go about our lives just business as usual. You don't think every time you go to the bathroom which muscles you're engaging, which muscles you're letting go, and if they're doing the right thing. You just know that you went to the bathroom and it was normal. So creating some awareness around those muscles, which we're using, can really help with that bladder control, with bowel control, as well as the frustration that happens when there's leaking or accidents. You might be using the muscles, but not very effectively, and we can go over some things to help you understand which muscles you're using and make sure you're using them in the right way. There's also bladder retraining. When you have kind of an insult to these muscles, you might get into bad habits. You might find yourself peeing every time you have to leave the house, just in case, so you don't have to go when you're out and about. And that can retrain the bladder to teach it that it is ready to pee when it's only a quarter full. And so now all of a sudden you're getting these signals that you got to go, and your bladder really isn't very full, and you could potentially wait longer, but you feel like you need to do it now. So we can kind of work on retraining that, getting those signals working a little bit better so that you're not feel like you're rushing to the bathroom all the time. I'm going to go back to this anatomy slide real quick. When you have a prostatectomy, when the prostate's removed, You can see in the center there's a chunk of the urethra that runs right through the middle of it, and that comes out with it. I mean, you can't save the urethra and take out the whole prostate. So the tubing is a little bit shorter physically, and that is a big disruption and trauma to those muscles that have a hard time kind of catching up. So a lot of pelvic floor PT is just making sure that the muscles are doing their job in the right way, and the way that they're supposed to work around those traumas that happen with surgery, with those procedures, or even with radiation. We work on core strengthening, the core, the abdominals, the low back. Those are all super related to the pelvic floor. That's where you get a lot of your support from. They found that with these lower abdominal muscles, if they're not working very well, the pelvic floor muscles actually don't function as well either. Then we've got just confidence. We'll go through a lot of different things in PT that really help you understand that what you're going through can be temporary, and how to fix it and how to build back that confidence. We'll talk a little bit more about that in a moment, but the more that you think about it, the more stressed you are, the harder it can be. Another way that pelvic floor physical therapy can help is with pain. Pain in the pelvic floor is super common. You can have pain from increased tension in the muscles, like a muscle spasm. You can have constipation as a side effect of many of the medications or treatments, and that can cause pain. And pain increases your stress. When you're stressed, you tense your neck or your shoulder muscles, right? I'm sure we've all felt that just tension that needs to be worked out. You do the same thing with your pelvic floor. You just probably don't recognize it. So when you're stressed, you're tightening, squeezing the pelvic floor muscles as well, and those get tense and sore. It can cause some problems. And so physical therapy can help, recognize when those are too on and we need to get them turned off a little bit better. Sexual function is another thing that PT can help. Sex, it looks different with or after cancer or surgery or treatments. You need good muscle activation to get good blood flow, to get and maintain an erection. And working on those muscles, staying active, can help with the sexual function by helping with just the blood flow into the penis and getting things working better. It's also important. It's important to understand that things may just look different than they did before. So open communication with your partner, being willing to try different things, can lead to a fulfilling sex life, even if it doesn't look the same as it did when you were in your 20s. And PT can at least help with the muscular side of that. There are also, intimacy and sex counselors or therapists that can help you and your partner work through any of those frustrations or help problem solve that as well. But from a PT standpoint, we can get the muscles doing their job and getting it set up for success. So if you were to come into PT to address some of these issues, what would you expect? We would evaluate your pelvic floor muscles. Sometimes in some PT clinics, that can be with an internal exam in through the rectum. And they palpate and see how the muscles are turning on. What I do usually is just from the outside, I can feel things pretty well. Push on you a little bit and have you turn on the different muscles and see if you're turning on the right ones, if you're turning on too much, not enough. Can you differentiate between the muscles closer to the penis, the ones around the rectum, and do some training around that? Because making sure you've got the right muscles going at the right time is how you can control this. And again, going back to when we were potty trained as kids, I mean, you figured it out, but we haven't thought about it since then. So it takes a little bit of effort, conscious effort, to get into the right zone with that. We also do, we can have different techniques. We have an ultrasound machine here that we use. There's different kinds of, we call biofeedback, where you can put sensors on the muscles and have you turn them on, and it can help you understand, like, oh, this is what it feels like when I get the right muscles going. The ultrasound's actually pretty cool. You can see the muscles contracting, and we can see the urethra being closed off or not. And so as you practice with that visual feedback, you can get to what it feels like. You can understand what it feels like and kind of take that home and practice and really get some good success with that. So we do training, with that biofeedback, with the ultrasound, or just, some good old fashioned tips and talk therapy. We can kind of train on how to get those muscles used better, help you get them doing what they're supposed to do. You'll get some homework to practice using your pelvic floor and kind of getting used to how those muscles work. We'll also talk about stress relief, breathing, relaxation techniques. Like we talked about, stress can really take a toll on the pelvic floor. So, what does stress relief look like for you? Is it getting out of nature? Is it doing a puzzle? Is it, whatever it may be, watching the show, being with loved ones, finding time to have those moments where you are getting some relief from your stress. Belly breathing is a really important thing that we talk about in pelvic floor PT. Where you take a deep breath. That's something we can all practice right now. If you take a deep breath and try not to let your rib cage expand, I'm going to move the camera just a little bit. When you breathe, your ribs come in and out, right? But if you breathe into your abdomen, if you breathe down and kind of stick out your belly, so your ribs aren't moving very much, you get a deep breath and the diaphragm expands downward as opposed to just out. And that deep belly breath is really calming for the nervous system. And it's been shown to help with stress and anxiety. So let's do a couple together, just a few deep breaths. Breathe into your belly. You're going to stick out your abdomen as you take a breath in. You can hold for a moment and then slowly breathe out. Right? You can feel that expansion downward as opposed to out into the rib cage. It's a big, and when you do that, you can actually feel your pelvic floor kind of expanding as well with that deep belly breath. So a lot of this is just trying to connect your brain, connect your nervous system to what's happening in the pelvis, because it's been through a lot and it may have more to go through. And so understanding those muscles a little better is kind of the main point of that PT. Relaxation techniques, along with that belly breathing, we get into the core, like we talked about, hip muscles. If there's weakness, tightness in the hips, that can make the pelvic floor tight. If you just don't have the flexibility through the pelvis, that can affect things as well. So we get into stretching, strengthening, into all those neighboring muscles, as well as the pelvic floor itself. That's kind of what to expect during a typical PT visit. The first visit, we do a lot of evaluation, talking, kind of teaching some things, and then the subsequent visits are kind of up to you how much you need. It's different for every person, coming back in and trying some of these other techniques as we need to get you back to where you need to be. So this is kind of the bread and butter of pelvic floor PT. I'm sure you've heard of this exercise before. It's called a Kegel. I don't know who Mr. or Mrs. Kegel was and how they got these exercises named after them, but the Kegel is basically a term for the contraction or activation of your pelvic floor muscles. So I've made you do a little belly breathing. Now we're going to do a little pelvic floor contraction and relaxation. Okay. This is something that we give everybody that comes in, and a lot of times it's, it could be for retraining, to get things stronger, to get things more relaxed. But either way, it's about connecting and understanding how the muscles work and what they feel like as you turn them on. So we're going to go real quick. I'm going to jump back a few slides. I'm sorry for the flashing on your screen. So we are going to look at two different muscle contractions. We're going to try to isolate these back muscles around the anal sphincter, and we're going to try to isolate the muscles up front around the penis. Okay, so two different functions, two different muscle groups, but they are super closely related. You'll find that when you try to squeeze one, you're probably going to activate the other, and that is okay. What I want is that you have a focus on one or the other. If you're working on the front muscles and you feel the back ones turn on too, that's fine. Do you feel the front ones? That's what I want to know. Or if you're working on the back muscles and you feel the front ones, can you concentrate on the back ones? It's like two people talking to you at the same time. Can you pick out, isolate one voice and focus on it for a moment? So the first set of exercise, there's exercise here. is you're going to tighten the muscles as if you're stopping the flow of urine. So think about kind of retracting, pulling in your penis a little bit. You're going to hold that for 8 seconds, slowly relax. Now, this is a homework I give people. So it says on here to repeat 2 to 3 times, 6 to 8 times a day. That sounds like a lot, but it doesn't take very long to do. But let's just focus on the movement first. So together, I mean, as you are at home, let's tighten up those muscles as if you're stopping the flow of urine. Do you feel a little movement in the penis? Do you feel the muscles tighten up? Hold it for a second and then relax. As you let go, do you feel them release? Do you feel things kind of sink down into your seat, into your pelvis a little bit more? Um, Now, another question is, do you feel a lot of other muscles turning on too? Sometimes when we turn on these muscles, we squeeze our butt muscles, our glutes. Sometimes we squeeze our thighs, our inner thighs. A lot of other things try to come in and help make you feel like you're getting this really big, robust contraction, but really it's not coming from the right place. So there should only be movement around those front muscles of the penis, not anywhere else. So can you squeeze just light enough to feel those muscles turn on? Can you hold for a second? Can you relax? This is something you can do a couple times throughout the day. Now, if you dive into Google and look up Kegels, you'll find 500 different varieties of ways to do them. Most of them will have you do really hard, big, solid contractions and hold for a long time and do a bunch of them in a row. But you'll see on here, I'm asking for 2 to 3 times, and that's it. And then you do it again an hour or two later, but only 2 or 3 at once. And down at the bottom, it says 40 to 60% capacity for the contraction. That means you're not squeezing as hard as you can. Because the goal with this isn't to give you the strongest pelvic floor ever. We can get there. The goal is to connect with it, to feel it. Can you turn it on? That's where we're starting. Can you turn on the right muscles at the right time? And if so, then we can build on that from there. So this is just about turning them on. So then the second one are the muscles around the anal sphincter. So down lower. So tighten the anal sphincter as if you're stopping gas from escaping. Hold for the count of 8, then release. So that's again toward the backside. Can you tighten up that anal sphincter? Visualize that circular muscle kind of closing up, holding it there. As you hold it and then you relax, do you feel the muscles come down? It almost lifts when you tighten and it comes down when you relax. Those are the things that we're looking to feel. If you feel that lift around the anus, you feel it relax when you let go, you're in the right area. You're doing it right. If you feel the muscles around the penis engage when you do that first one, and you feel them relax when you let go, you're doing it right. So it's practicing that, kind of creating that awareness around those muscles. And then from there, we can build on that in whatever direction you specifically need to go. The third one is lifting that perineum into the body. There's a tip here, nuts to guts. It's like you're trying to retract your testicles up inside of you, right? It's kind of between the two. We did the front, we did the back, and now this is right in the middle, just a lift up. And again, these are so closely related. This is not a big area, and you're going to get some activation on both, all the areas around it, and it's fine. But can you feel that perineum, that central area just in front, just below your testicles? Can you feel that lift a little bit away and sink back down? Then you're getting it right. So these exercises are something that you can start now to kind of build that awareness of what's going on. How are they feeling? Can you feel them at all? Do you feel like you have any control over it? But the key with these is to not squeeze as hard as you can, just 40 to 60%, which if you can tell the difference between 40 and 60%, I think you'll be the only one, just not as hard as you can. And then also to feel them relax, feel it come down and release as you let go of those exercises. And there will be a handout that'll be sent out to you with some of the information about the anatomy as a refresher, but also this will be on there as well, something you can look at, hang on to, and practice at home to try to build that connection, that sensation in your pelvic floor. So if you do want to come to pelvic floor PT, I am a little biased, but I think it's pretty helpful. I think we do a good job. The first step is talking to your doctor. You need a referral like you would for any other physical therapy. You can search for a pelvic floor provider in your area. If you have a clinic close by or one that you've been to before and you're comfortable with, you can always call and ask if they do pelvic health. Many do, even if they don't advertise it. Or you can schedule with a legacy PT. Our number is here on the screen, and it'll also be on the handout as well. This number with a referral will take you to our central scheduling office, and you can ask for me or somebody else at another location that may be closer to you. I'm at Good Sam here in Northwest Portland. There aren't many of us, so it can be kind of a long wait to get in. If that's the case, you just ask to be put on a wait list, and things are always popping up faster than you'd think. But it's not hard to find a pelvic floor PT. Along those lines, I do want to say this is something that, especially men, we don't talk about often. I mean, how often are you talking to your friends about how many times you get up at night to pee and any issues with bowel movements? It's not something that we're comfortable talking about. But it is very normal. It's something everybody does, of course, but something that many, many men deal with, whether it's in conjunction with a cancer diagnosis or whether it's not, just regular old prostate issues. So this is a very common thing, and talking about it, coming in and discussing it with a professional can really help kind of take the mystery away from it and help understand what's going on in your body and how we can take control over it. I think that's you might have seen on the flyer for this class, it was going to be me and my coworker Claudia, and she recently retired, but that was her whole thing, is that you're in charge, not your bladder. Is don't let your bladder tell you what to do. You got to get to the bathroom dry and in control, and that's something that we can work towards, and we can help you make that happen. So some other resources that I think are super helpful. Legacy has some cancer videos similar to this one. I think this talk will be kind of added to that list. On YouTube, if you go into YouTube and you search Legacy Health Cancer Education, it'll get all those videos pulled up. There's a whole bunch of them, and there's one specifically for sexual health for men with prostate cancer or other cancers, and also one for couples that I think is very relevant to what's going on. And I mentioned sex therapists, counselors, this website, they're this group, the American Association of Sexuality Educators. They have a website as well, and these are also on your handout, the links to these, that can help you, connect with a counselor or a therapist to kind of talk through some concerns, difficulties, some issues that you may have around that. But I believe that is the bulk of what I wanted to talk about today, to kind of discuss a little bit about the pelvic floor and what we do as pelvic floor PTs, and how it can be helpful to someone with a cancer diagnosis or in a situation you may find yourself after a prostatectomy, surgery, radiation, any sort of treatment that can really affect things. And things might not be normal, and we can get them as close to normal as we can, as something that is worth some effort, worth some work putting into. I just think it's important for people to know that you don't have to resign yourself to whatever state you may be in now of incontinence or pain or whatever. There's always something that we can try, something that can be done. So I think we'll pause for a moment, and then we can kind of open up for some questions.